Worried about your baby's fever? Here's when to call the doctor. I'm Dr. Nancy Silva, mom and pediatrician in Wesley Chapel, Florida. First and foremost, fever is our friend. Fever actually lets us know what's going on with our bodies. It lets us know that we probably have an infection, and it also is letting us know that our immune system is working really hard fighting that infection to cure us so we can be healthy. But there are times that you as a parent and me as a pediatrician, we should worry about when your child has a fever. It always seems to happen at like 2 a.m. in the morning, and you have a little baby and you go, oh my gosh, what am I gonna do? So I'll always tell you, give your doctor a call when in doubt, but here are some red flags for you to know when you should be worrying and when you should be considering going to the ER or just calling your doctor. Most importantly, if you have a baby that's less than 2 months old, we worry more about them. They don't have the same immune system as older babies do. And although you do have some maternal antibodies, it's not the same. So if your baby has a fever of 100.4 or more, and they're less than 2 months old, you definitely want to call the doctor. The doctor, your pediatrician, will ask more questions like, how is the baby drinking? How is the baby feeding? How is the baby peeing? How is the baby pooping? How's the general attitude? Is the baby smiling when the fever's down? Is the baby super fussy? Is the baby super sleepy? All those questions give us an idea of whether we should tell you to go to the ER or not, because we do worry in infants less than 2 months old. Since their immune system's not as strong, they are at a higher risk of getting something called sepsis and something called meningitis. Sepsis is a blood infection that infects the blood throughout your whole body, and meningitis is an infection of the linings around your brain, the meninges. They can also have a pneumonia, and all of these may not show the typical way. So you definitely want to give us a call and consider that you might be going to the ER, depending upon what the pediatrician decides once we get all our questions answered. Now for older babies, if they have a 102 for more than 2 days, or if they're acting very fussy or irritable, despite the Tylenol, also known as acetaminophen, that you give them, you want to go ahead and make an appointment with your pediatrician. But here's a tip. Whenever there's a fever, if the Tylenol lowers that fever and your baby's fine and acting great and drinking and playful, usually it's just a viral infection and they're going to be just fine. But if it's more than 2 days of that 102, then I'll tell you to come on in and let me check them out. Let me see, do they have an ear infection? Do they have a pneumonia? Sometimes the pneumonia is so little you can barely hear it, but we can hear it with that stethoscope and we can help treat your baby. What are some red flags that we definitely worry about and we tell you definitely call us and we can guide you whether you need to go to the ER or not? The most important one that's first is dehydration. What are the signs of dehydration? Your baby's not drinking, your baby's not peeing, your baby's starting to get very sleepy or very irritable. It's interesting, but it's always either very sleepy or very irritable. So that's a big clue. Sometimes they're not peeing and what you see are these little like orange, reddish, actually there's a little bit of blood when it's red, but they're peeing crystal-like in the wet diapers. And that's when we really worry and we start talking about going to the ER. They can do a full examination of your baby. And they'll also do blood tests and urine tests and try to see what's going on. We can get a good idea from the blood test if it's viral or if it's a bacterial infection. And most of the time they will start IV fluids, especially when there's those crystals, we call them urate crystals. When they're involved, we just have to save a baby from dehydration because it can go from bad to ugly real quick. Second red flag is difficulty breathing. If your baby is having like short, rapid, shallow breaths, we really worry about that. We want normal breathing for babies, which usually is some variation. Sometimes they breathe faster, sometimes they breathe slower, but rapid, shallow breaths is usually a red flag, and then we start worrying about, again, sepsis and pneumonia on the top of the list. Dehydration can also make you breathe fast, can make you breathe very rapidly, but either way, that's a sign that there's something more severe going on and the baby needs an evaluation and possibly treatment. What's the third red flag? Excessive sleepiness or excessive fussiness. Basically unusual. Babies can be fussy and sleepy and hard to get to sleep and hard to wake up and hard to feed. This is what they do. But when it's unusual, when you can't console your baby because they're that fussy, we worry. When they're just sleeping a lot, it's hard to wake them up. That's when we worry if they're truly lethargic. Now there's tired and then there's lethargy. The lethargy basically is a big decrease in their typical usual activity. I wouldn't say they're completely limp, but they can be. I hope you found this helpful. I've also created, especially for you, a Fever 101 Tips Guide. It's totally free. You can find it on my website, drsilvakids.com, or you can click on the comment below and you can go ahead and get the download. Until the next time, be kind to yourself and bye-bye.